Good morning, everyone. My name's Shirley Slann. I'm an independent director on ANROWS. My background in family violence is from working in Queensland for many years, from Mount Isa. I've just recently moved to Victoria. Before I go any further, I'd like to acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation, all elders past and present. In regards to the presentation that you're about to hear, that will go for 25 minutes, and then after that presentation, there'll be time for questions, which will take us up to lunch. We were hoping there'd be a longer period of time, but with the time lapse that's happening, if anyone's got any questions after the presentation, they're more than happy to contact the speakers afterwards. So the presentation that you're about to hear is the effect of social and geographical isolation and remoteness on the ability of women to disclose, report, seek help and receive appropriate interventions following experiences of domestic violence and/or sexual assault. So I'd like you all to welcome Sarah Wendt, who is an Associate Professor of Social Work at the University of Flinders. She has published extensively on violence against women, including most recently, Domestic Violence in Diverse Contexts, a Re-examination of Gender, Routledge 2015. Her current research projects explore the impact of domestic violence on women's citizenship, service provision for Aboriginal communities experiencing family violence, and engaging men to address domestic violence. In particular, Sarah has been researching rural women's experiences of domestic violence for over a decade in Australia, and she is currently exploring rural women's help, seeking decisions and coping with domestic violence. Please welcome Sarah.
Thank you, Shirley. Thank you, everyone, for your interest. We wish to acknowledge the traditional owners on whose land we are gathered today. We pay our respects to their elders, past and present, and I thank you, Auntie Georgina, for her welcome yesterday. So today, before I start, I would also like to acknowledge the collaboration that has gone into this presentation as well as this research project. I've been working with Alison Elder in South Australia, representing the University of South Australia and Flinders University. Also, this project has been done in collaboration with Curtin University, and so I want to acknowledge Professor Donna Chung, Antonia Hendrick, who will also be speaking with me today, and Angela Hartwig, so thank you. I also want to acknowledge Centrecare Catholic Family Services in South Australia, who facilitated connections with Whyalla, Murray Bridge, the Riverland and Mount Gambier. In South Australia, I would also acknowledge the managers from Port Lincoln, Port Pirie, Coober Pedy and Sejuna for their input, and the Victim Support Service in Whyalla. In Western Australia, we acknowledge the Aboriginal Family Legal Service, the Women's Council for Domestic and Family Violence WA, Anglicare WA and the Department for Child Protection and Family Support in Western Australia. Throughout this project, I'm probably going to slip into just using the term rural. Regional, rural and remote are terms that are often commonly used in Australia to refer to large landscapes and small towns that lie outside the major coastal cities. There's really no agreed upon definitions or categories of rurality, so today we're just going to use those terms fairly broad. Today, what I would like to do is just firstly say that this is a 2-year project and we're halfway through it. And so in summary, we've written the State of Knowledge report, which is available on ANROWS website. We've also conducted interviews, face-to-face interviews with women who have experienced domestic violence and family violence, and we've conducted focus groups with workers across 5 states. And so today, I just want to achieve 2 things. Firstly, to provide you with a brief overview of the project, and second, because we've only just embarked on analysis of the data, today we will focus on the preliminary broader themes that have emerged from the focus groups across South Australia and Derby, Western Australia in terms of service delivery in this space. We cannot present an analysis of the women's stories due to time, and these interviews were really diverse, complex and rich, and hence requires deep attention and analysis, which we just haven't reached in our timelines yet. So today, I'm going to introduce you to the 5 sites briefly, give you an overview of the research project. I'm going to speak to some of the emerging themes from the 4 sites in South Australia that were represented, and then I'm going to hand to my colleague Antonia to talk about the experience in Western Australia. And then I just want to finish up with some very early reflections and questions about where to from here in terms of this project. So, this is where we've travelled. We went down and visited Mount Gambier, where we conducted interviews with 5 women and 1 focus group. For those of who don't know where Mount Gambier is, we're halfway, well, between Adelaide and Melbourne. It's a fairly big regional centre. We did also Murray Bridge. We interviewed 5 women and a focus group. Murray Bridge, although is about a 1-hour drive from Adelaide, covers a large geographical distance in terms of service delivery. We also went to the Riverland and interviewed 5 women and did 1 focus group. That's about a 3-hour drive from Adelaide. Similarly, Whyalla, which is about a 4 or 5-hour drive from Adelaide. We conducted interviews with 3 women there and a focus group. And let me introduce Derby as well. 5 women were interviewed and a focus group were held. So just to give you an overview of the research project, the specific questions guiding the project were: how does social and geographical isolation impact on women's decisions to disclose and seek help for domestic and family violence? And how does social and geographical isolation shape women's coping abilities when experiencing domestic violence? These are our specific guiding questions. We used the qualitative case study design because we wanted to include the active participation of service providers. We wanted to know what is it like for them working in this field while living in a remote, rural or regional place. And these partnerships enabled women to tell their stories of seeking help and coping with domestic and family violence. I also want to note that consultations were held before the project at each site, explaining the purpose of the project, and discussions were actually had with those local services on the best way to help enable women who had experienced domestic and family violence to participate in this project. We interviewed women face-to-face. In-depth semi-structured interviews were conducted. This enabled richness, depth and complexity from individual women's stories. Women were asked to talk about their reasons for seeking help, how they sought assistance, what shaped their decision-making, and asked to reflect on how they'd coped with domestic violence in their lives, periods of time they didn't seek help, and what influenced their decisions to cope alone. And so with the assistance of each agency in the sites, we were able to interview 5 women from each of those sites, so 20 in total, plus 3 from Whyalla. We also conducted focus groups at each one of these sites. Focus groups enabled workers to come together to discuss their perceptions, opinions and practice wisdom about working in isolated places and how such context actually shapes their work. I also just want to note that because there was a significant amount of interest in this project, we actually managed to hold 2 additional focus groups, one in South Australia with other regional managers and one additional one in Western Australia with Kimberley regional managers of domestic and family violence services. We also just want to have a look at the H2H data, and so we will embark on that as well with time. I just want to quickly put this up because this just shows another snapshot of what we're trying to do in terms of analysis. Thematic analysis of these different data sets is our aim, to build a case study for each site. So I want to be able to say something for the local context of each site, considering their input into this project, but also I want to be able to say something more broad or larger thematic messages about isolation and service delivery in the area of domestic and family violence. And so today, If you just have a look at the bottom of the triangle, it's the focus groups where we've started, and that's what I'm going to present to you today, some of the preliminary analysis of these and what are some of the emerging themes that workers have been talking about. So the themes that I would like to introduce you to, firstly from the South Australian context, are what I've named broadly crisis, the workforce and geography. So let me start with crisis. By introducing this theme crisis, I want to talk about the nature of domestic violence work. In all South Australian sites, the evolving nature of domestic violence work was discussed at length, and perhaps these issues are not unique to rural and remote places, but I think they play out in particular ways. Over time, with awareness raising about the issue of domestic and family violence, with a focus on high-risk assessments and working towards integration in service delivery, for example with police, the need for domestic violence services actually has increased, but this increase hasn't necessarily been matched with more resources, funding, time or staff to do this work. Let me just say that workers were actually positive about these changes. They believed in these changes and they were needed, but at the same time described feeling squeezed, tighter and tighter. Words like stretched were used frequently. So increase in demand we are seeing, but not in resources and infrastructure to respond. This pressure actually shapes domestic violence work, and it actually has a ripple effect on the recruiting and the retaining of staff, particularly in rural and remote places. Workers felt that all the energy in domestic violence response was going to crisis management and responding to high-risk assessments. Let me just read the first quote to you to demonstrate my point. We do crisis management predominantly. It has an impact on certain systems. We don't have the people on the ground to deal with a tsunami. So with the focus on high risk and predominantly in crisis management, many workers expressed concern that other domestic violence work wasn't being attended to the standard that they would have liked because they didn't have the staff or the capacity, and the two areas commonly identified as a concern for rural and remote workers was one, outreach, how to outreach into large geographical distances, and number two, how to provide ongoing longer-term counselling and support for women. And so I just want to read the second quote for you. Counselling appointments are few and far between because we're dealing with crisis all the time. I have to cancel counsellor appointments more often than not because there is always more pressing need. Also with working in high risk and crisis, many felt worried and concerned about keeping up with the paperwork. Now let me also say that workers understood accountability and they defended the need to report their work. They didn't have a problem with it. But at the same time, they felt like they were drowning and hence would actually work after hours to deal with this paperwork and the level of reporting. Furthermore, with an awareness of domestic violence and attention to the high risk, more than one site in South Australia reported that they felt sometimes pressure from other services, particularly mental health or drug or alcohol, that they had to respond to all women. And I'll just read the third quote. If there's even a sniff of domestic violence, all the services just refer to us straight away, but we can only deal with the high risk. I heard similar stories over and over again that the more complex women with multiple needs, that is mental health and drug and alcohol, weren't really being addressed or case managed as collaboratively as it could be. And perhaps all human service sector agencies in rural and remote places are feeling this similar pressure. But domestic violence specific agencies often described feeling a bit like a dumping ground or palmed off, and phrases like, well, you explain it to the coroner if you don't take her, were often used. So the risk and the fear of domestic violence was becoming the trump card in this pressured system. So stretched services creates actually a ripple effect, and due to the complexity and the long-term nature of issues, the question of where do we even start was starting to get asked more frequently. I also want you to now just to hold that description of pressure and stress in your imaginations, because in addition, many managers express concern around the short-term funding arrangements and the tender pressures to keep their services operational. Again, this adds to the pressure that the service felt, uncertainty about the security of employment, and using precious time on additional paperwork that tendering brings with it. Furthermore, managers expressed to staff thankfulness for not looking for another job because their contract was nearly up, and hoping that they would be able to hang on to these contracts for their workers. So the risk of employment security often added extra pressures to already highly pressured work. So in summary, sites felt they were working and responding in crisis, so highly pressured work, but also under pressured conditions, and hence other domestic violence work that goes beyond crisis unfortunately becomes sidelined by systems and lack of resources. I now just want to introduce my second theme that we're looking at, and that's the workforce. I want to introduce this second theme by sharing insights into how domestic violence shapes workers living in and working in communities where they are highly visible. Local people knowing local people, or working and living in the community for some time, let me say, was seen as a positive thing, generally seen as positive in all sites. The support networks, the shared understanding, the love of place was an important part of domestic violence work. The knowing who to call, the familiarity of faces, having other local champions around you was comforting, and it was actually effective. And so I just want to read the top quote. What works between services is sustainable relationships enhanced by a lot of us being on the domestic violence action groups and meeting regularly. I would like to acknowledge at this point that we heard many reports and examples of additional labour in this sector. So local champions matter, who have a strong understanding of the complexity of domestic and family violence. It was actually local champions that enabled this research and collaboration with us, and that the majority of these local champions are women who devote their entire working lives to domestic violence. There is precious leadership displayed here, but what happens when local champions want to retire or just want to rest? So the flip side to this theme was sometimes a concern in succession planning and ensuring a sustainable workforce. For example, I also heard, we can't keep workers, this work is too hard, or the wages aren't comparable to other human service sectors. So in addition, when one lives and works in the community, doing domestic violence work shapes personal lives in particular ways in smaller communities. So for example, many workers reflected on the visibility in the community and gave examples of changing their life practices to fit with their work practices. One worker spoke to me at length about one time where she just didn't visit the local school to see her grandchildren because she was very aware of a perpetrator watching her interact with her grandchildren. The old story of many workers actually doing their grocery shopping at 7 o'clock in the morning to avoid crashing into people that they know. Or other workers told me you'd be at the pub having dinner and a client would come up and start apologising for missing that appointment and try and reschedule it. So let me read the second quote just to demonstrate this point. My world is getting smaller every day. For example, if I go out to a hotel and there is a client who is reconciled with their partner and they are sitting a few tables away, he starts staring at me. I've had threats and have asked police to patrol my house. So finally, many workers reflected on the skills needed to do domestic violence work in rural, remote and regional centres, and they often described feeling inadequate or overwhelmed, which I just want to note is often reflected by women and it's often reflected by the social work profession. But for me, this isn't about individual ability, this is about a systemic and a structural problem. It's this level of honesty and often influenced decisions where workers worked after hours, and it's this conscientious part of the workforce that I think is invisible. I just want to also now quote the third message from one of the workers. My case managers have to be a Jill of all trades. So again, many workers spoke about that they aren't just dealing with domestic violence, but intersecting issues such as mental health, drug and alcohol, homelessness, or unique issues for Indigenous communities and families, or cold families, spent a great deal of stress on workers. They spent time talking about this with me. Managers and workers spoke about having to be multi-skilled, but that nobody can be multi-skilled and have all that knowledge, that this takes a really long time. Some felt very pressure from the community that they can solve all problems and expectation that a rural worker can be all things to everyone. I would also like to mention that all sites talked about the lack of responses for men who use violence, but not just lack of an absence of a program here or there, but the high level of skill and expertise needed to work with men and understand the tactics of abuse present in domestic violence. So I kind of see we have a system trying to respond to women in crisis and trying to understand and intersect problems such as mental health, drug or alcohol, but again, due to the lack of resources and the pressured nature of this work and the need to respond to crisis, we have very limited resources responding to Indigenous women's needs, cold women's needs, and I could go on, as well as working and engaging with men was not being addressed beyond criminal or police responses. My third theme that I want to introduce before I hand over to Antonia is geography. I want to introduce geography to share some unique factors that shape and influence domestic violence work in isolated places. So often when we think of rural or remote, we can actually unintentionally refer to stereotypes or hold particular assumptions that populations in rural, regional and remote communities are all the same. However, workers raised this issue to actually share the diversity of women that they are trying to assist at any one time. A worker said, "The diversity of women and families you're actually trying to engage with requires different strategies and another level of complexity, which I think is often invisible." All sites spoke about the different groups of women that they were trying to support and engage with. And throughout this presentation, I've already named mental health issues, often associated with trauma or drug or alcohol issues. But workers also identified in their communities transient families, so families that haven't lived in the area but come through for a variety of reasons, often with the assumption of cheaper housing or looking for work. Workers spoke about the large gap in socio-economic status and how the service and response can be very different depending on the status and class in the community. So engaging and working with unique needs of women was actually at the forefront of workers' minds, but balancing this with the volume of crisis response. So, for example, engagement and community development with cold communities or Aboriginal communities didn't receive the time needed, and this actually worried agencies. They talked about the worry they felt about this. Again, the long-term engagement often needed to reach these communities. So in terms of this theme, I also want to highlight distance. Distance dominated much of the focus groups and how that impacts and shapes domestic violence work. So with the increase in demand for crisis, high-risk work for many agencies felt that they were servicing the regional centre predominantly, so the regional centre, so whether that's Mount Gambier or Whyalla or Berry, for example, but predominantly not getting out to the outlying regions listed in their catchment area. One worker said to me, "It's the women on the isolated properties or in those smaller towns that worry me, and that's what keeps me up at night. We just don't have the capacity or the time and how to think that we could reach them." And when they do get a referral or contact from a woman who lives hours away, it requires a lot of planning, and the response impacts on the limited time and resources at the agency. The servicing over vast distances was a point of worry for many workers, and many described it as dangerously underfunded and under-resourced to do this level of work. And I'll just read that second quote. "You cross your fingers that you aren't going to get too many remote referrals in the week. I feel powerless as there is nothing I can do for those women. There are no services I can put in place for them. My worry is intensified, amplified. The isolation makes everything louder, brighter." And I couldn't have put it better myself. With this work of trying to reach and service over vast distances, the issue of safety was also raised. There were some degrees of diversity in this practice where agencies would try and arrange for the woman to come to town or meet them somewhere else so they didn't have to meet them in their home. But often agencies are up against lack of transport. That woman has a lack of transport, doesn't have money for petrol. The woman worries about the time that she'll be away from the house and having to explain that, the fear of coming to the service, And so these decisions were always made on an individual basis. The extra level of planning was in the forefront of workers' minds, which often created another level of anxiety for the work. And this is what a manager said to me. As a manager, I worry constantly about not having the capacity to have 2 workers go out for home visits. We try and problem solve for the women to come here. We ask what is the closest place we can meet them so that we aren't going into something directly we don't know. And what about mobile phone coverage, which was also a concern. I'm just going to pause there and ask Antonia to give you an overview of the themes in Western Australia Derby.
Thank you, Sarah, and I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to the elders past, present and those into the future as well. The themes similarly displayed under those 3 titles for Derby, and Sarah's given a very good and thorough overview, so there is some overlap. So crisis, workforce and geography of the Derby site. Crisis, there were 2 key points in relation to crisis in relation to the Derby information from the workers, in relation to the need for perpetrator programs, the lack of these. This was strongly vocalised, and secondly, the housing and accommodation options for women. Perpetrator intervention programs for men to access and individual counselling was overwhelmingly expressed by workers as a need, and requires funding and appropriate sourcing in order to be established in Derby. There is a men's shed that's started over the last couple of years in Derby, and it's been people are starting to engage with that particular program, but it's not enough, and obviously it's not primary intervention, if you like, or crisis intervention. So the quote here that I've extracted from one of the workers is, for the man to realise that they actually need to change the way they do things, counselling support and some sort of service delivered is needed, otherwise you'll just have these very angry men out there. The other area of crisis identified is what to do with, is in relation to housing availability and accommodation options. So difficulties were expressed by workers in relation to women securing affordable and appropriate housing options. And the local refuge, the women's shelter, had experienced many difficulties when referring women onto other accommodation services due to lack of available beds and the nature of bed count changing frequently. And often they experienced that the bed count linked to funding meant that it was difficult, because often the women would come for the day to seek refuge and then go to families at night time. So it wasn't a true indication. There was also a difficulty experienced in relation to women reapplying for the rehousing program. So if after 2 weeks they were not actively engaged in the service requirements or procedural requirements, they were taken off the list, if you like, and had to reapply, and there were lots of barriers in relation to that. Workers also reported that women mostly self-referred, and there was also the issue of overcrowding with lots of children, babies and children in the same room. So the quote here is, "This is like this cycle. It's like the women who come into our service, they're self-referred, most of them, but we also have 2 other families they were referring to. She can't keep her baby in one room with 4 or 5 kids." So that was related to overcrowding. Referring women on is not ideal either, and securing a bed, as mentioned before, was identified as difficult by the workers. And in relation to securing accommodation outside of the geographical area was difficult as well. Often the refuge talked about if they did seek alternatives outside of the area, The women were considered not in need, or they were safe from domestic violence. So the quote here used is, we used to go to Darwin, but the Territory won't accept anyone from interstate. We sent one lady to Darwin and they said, you're no longer in a domestic violence situation, you're in a safe area now. So I had to bring them out and find a hostel where she could go into. It's getting harder, they said. Also, a lot of the women were in maintaining housing was difficult. Many of the women were in private rentals, and I won't read all of that quote because it's quite lengthy. But some of the issues were the 3 strikes and you're out approach to private rental, a lot of family coming to visit the women and the families, and this was difficult. This was experienced as difficult as well. Workforce. So there were 2 key points that came from the workers, the focus group as well, in relation to workforce, and that was, and we've heard a little bit about this earlier, in relation to collaboration and information sharing, and the second thing about supporting, attracting and retaining staff in these particular areas. So in relation to interagency collaboration and information sharing, the workers agreed that there needed to be greater collaboration. Over the last few years, they did say that there has been some collaboration. This has improved, but they would like uniform guidelines for working across privacy, boundaries and different mandates. At present, they're feeling like that's quite convoluted and in need of tightening processes so as to coordinate more effectively. Currently, there is a triage model between the police, the Department for Child Protection and Family Support and non-government domestic violence services. But again, what was expressed as a need was multi-agency case management model to be established and funded. So the quote here was, break down the barriers between the organisations for the purpose of making the person safe, whether it's a woman or kids. It's communication, one referral to fit everybody so they're not breaching confidentiality or privacy, and you're protecting the victim. In relation to attracting and retaining staff, there was a lot that was mentioned in relation to recruiting, mentoring, training and supporting local people to become specialists in domestic and family violence within the region. The quote here speaks highly of training Indigenous people in the area. So there seems to be Indigenous staff who stay, and there seems to be a high level of non-Indigenous staff who move. We really need to support local Indigenous people because it's not a field that a lot of people go into. They, Indigenous people, have the heart of the community and want to stay on. So it speaks to capacity building, but also cultural capital of the region and the people working in that area. Supervision and support for workers of the region was identified, and needing structures to support workers in this particular region. For greater collaboration, sharing and debriefing. So the quote here is, if we're having a shitty day or whatever, it would be nice to be able to have someone outside who can provide a counselling service for when you're feeling unmotivated. It can be so mentally draining that you become unmotivated at work. Better support for workers in their space. So the workers talked about being quite passionate about change in these areas, but needing the support and resources to assist them in promoting that change. They also did talk about what is working. The women have very good relationships with the police in Derby and felt very safe and okay about approaching police for assistance and help when needed. Geography, and I understand we're quite tight for time here, so I'll go. There were pros and cons in relation to working, and it's been touched on previously, working and living in Derby, and they're related to personal professional boundaries, really. So your own family connections with the people that you're working with, so that can be a barrier and also a protective factor as well. So sometimes when you know the family, you can engage them in services, and other times it actually acts as a barrier. So here we know a lot of people in town and we're all related or connected in some way. So if you've got a family that walks in the door who's a victim of domestic violence and you're the only worker there getting that service to that person or that family is extremely hard. Being on top of personal boundaries as well to do the work that she needs is one of the biggest things I find. So again, the support there needed for staff. And the positive side of things is that they know you and you're a familiar face, so they feel they can be more relaxed and comfortable, and I guess you get more out, and that way you can think about how to support them and how to refer them better. Workers, and just the last point, workers spoke about the social networks as being really important to supporting or limiting the isolation of women in these particular areas. That's it, thanks.
Thank you, Antonio. If you'll just bear with us for one more minute, I'd just like to try and conclude and wrap up some of the things we've been saying. So overall, across the sites, we found that crisis work is at the forefront and managing risk. There were successful efforts of working collaboratively with police and other local agencies to respond to this work, and collaboration was seen as really important. However, in remote, rural and regional sites, due to limited resources, particularly staff, we've mixed this with vast population spread, and all agencies reflected that they felt all their energy goes in crisis, and hence other domestic violence work such as outreach and longer-term support to help women in their recovery was not possible to the standard that they would want in addressing and understanding other intersecting issues, whether that's mental health, drug or alcohol, poverty, and other unique factors for cold women, Indigenous women, and I can go on. So responding to and working with men was largely absent in all sites, and one I could argue that this impacts on and contributes to the high levels of crisis work. To often cope in this current environment, workers either leave the work and hence agencies experience regular turnover of staff, or staff go above and beyond their job descriptions and have work life invade into personal and family life. For example, workers do case notes after hours, they debrief after hours, they change their own personal practices in the community, they have limited time to explore and engage with professional development opportunities, network with wider sectors, for example. So in closing and sitting with these early reflections from hearing these stories, I want to articulate a few observations. The domestic and family violence agencies in rural, remote and regional places are vital. There is no question about it. They are engaging in highly complex work. However, crisis work is dominating in rural and regional and remote places because this is all the time they have. And the lack of resources actually reinforces this work context. This work is being predominantly done by women with years and years of experience of domestic violence work and knowing their community because they live in that community. This is largely invisible, underpaid, unrecognised work. What our findings are broadly showing that if we want to plan for sustainability and investment in domestic violence work and responses in rural places, we cannot ignore the reliance on the adaptability of workers to the local environments in which they live and work to meet the needs of women seeking assistance with domestic and family violence. But my concern is this: for government or funding bodies, the human service sector and local communities, let's not take advantage of and exploit this adaptability. Let's not take it for granted. Let's value it, let's invest in it, and let's support local champions. If we're going to tackle domestic and family violence in rural places, we need to work with local champions, but the right local champions. The local agencies understand their places, plan for their sustainability with them, invest in supporting in their generalist and specialist work so that we can seek longer-term solutions and recovery for women, men and families that actually go beyond crisis. Thank you.
Thank you, Sarah, and thank you, Antonia. in regards to your research. If anyone is interested in reading the full report, they can go to the ANROWS website, and I encourage you all, if you haven't already, download the app on your phone and have a look at what's happening at the conference. Sarah and Antonia, in regards to your research, it was interesting, I guess, having confirmation, even though the different areas that you covered with your research in regards to rural remote areas, like even though I lived and worked my life in Queensland, the similarities and the difficulties in regards to trying to service those areas, and your comments in regards to when people were out for dinner and you'd have someone coming up to you and trying to disclose information, and you'd try to do that as I guess, giving them privacy as much as possible by actually sometimes having to move them away from where you're sitting with other people because they started to blurt out information about their case, and still being able to get them to talk but keep their privacy and things happening. So I understand everything that you're saying in your report, and also us being aware about how to support those communities and being aware of worker burnout, the whole range of issues in regards to geographical location, isolation, and then some areas not wanting to take women from other areas because that's not in their actual area, which is actually unfortunate. And also it made me think about Aboriginal families too that have the big extended families where if a woman does have to get out due to safety, if they have got a number of children, like where it boils down to dollars again, the costs involved and so forth. So thank you for touching on those, and I think your research is excellent, and yeah, just want to thank you very much. It says time's up, so if anyone's got any questions, please contact Sarah and Antonia during the break. They're available. Otherwise, you could contact them if it's not at the conference. I'm sure they'd be happy to receive any comments, but please give them a round of applause.